Hi there, my name's Katriona. I'm a physio from Central Health Physiotherapy based in London, coming to you from my own home again today due to COVID-19 restrictions in the UK. So I'm continuing to do a lot of online consultations with my patients, and I have a special interest in treating runners, being a long distance runner myself, and I have extensive postgraduate experience. I've been asked by Run Through as part of Move It May to come to you again today, but to talk about plantar fasciitis, or what you may know as runner's heel. So what is plantar fasciitis? So us physios actually refer to this as plantar fasciopathy, as plantar fasciitis indicates there's an element of inflammation, which is not always the case. Plantar fasciopathy presents along a similar spectrum to tendinopathy, so things like Achilles problems or tib post tendinopathy. It has a similar response to load, and it doesn't like compression. So often compressive activities like running can set it off. So I've got a diagram here which shows the bottom of someone's foot. So normally patients report pain in this area here. So this is a thick band of plantar fascia, and it inserts into this bone at the heel. And often what happens is this little area here becomes irritated. Now, if we were to do an ultrasound scan on that, we often see that there's a thickening of this insertion into the bone, which is normally where the irritation occurs. Patients normally say the pain is localized to this area, but sometimes there's a little bit more widespread as well. That being said, sometimes GPs will x-ray this and they will find that there's a little bony spur on the heel. Now that's not something really to get caught up about, because it's been shown in the literature that doesn't normally correlate with symptoms in the plantar fascia. So don't get too caught up with that if you get diagnosed with a heel spur. It can be quite complex and not necessarily limited to one structure, because you've got fat pads around the heel and you've got a lot of nerves passing through. So it can be quite difficult to treat and get under control, as it depends on what's actually driving the pain. It is often an overuse injury and associated with training error, whether that be a change in your pace, your volume, your intensity, the surface you're running on, your footwear, or just too much too soon. It's very common. We have to be careful diagnosing it. Often patients come in and have self-diagnosed by looking things up online. And obviously we need to just make sure that we're ruling out anything more sinister. Sometimes people get stress fractures of their heel if they've really overdone it on the running. We don't want that to go unnoticed. So contributing factors can include being stiff in your ankle joint, in your big toe joint, having a high BMI, having a job that involves being on your feet all day. So especially if you're on hard ground or in hard footwear, if you've had a change in your training or you've changed your foot strike. For example, if you've transitioned from quite cushioned footwear to maybe more minimalist barefoot style running shoes, that definitely will increase the load on your plantar fascia. Also, if you're weak in your foot and ankle muscles, or even higher up the chain, your core, your glutes, hamstrings, that sort of thing. Patients tend to fit into two camps, so either more of a sort of pain dominant picture or more of a sort of intolerance to load type picture. So in the early stages, it presents more pain dominant, so people often report pain on getting out of bed first thing in the morning, that sort of classic first few steps of the day being really sore. Or equally, if they've been sat for a while during the day and they get up and move around, again, they get that painful sort of few steps until they get going again. It can also just be sort of just a weight bear and put pressure on it, especially if you're walking barefoot or without any cushioning under the heel. So in this stage, it's really important to try and offload the painful tissue as much as possible and get the pain under control. In the later stages, there tends to be sort of a more load dominant picture. So people might complain more of pain as a walk or a run progresses over time. So this is where I'd be less likely to try and offload someone, but try and look at improving their tolerance to load by building their strength and their power. So it's important to say with plantar fasciopathy that it's not uncommon for symptoms to really persist even up to about 2 years. And as a physio, it's more about managing and maintaining the condition throughout this time until it settles. There is also a huge gap in the evidence and literature for how we should be treating plantar fasciopathy as physios. So it's very much tailored to the individual, and what works for one person might not work for somebody else. Okay, so I've been asked to share with you the 5 most common questions I get asked about plantar fasciopathy. So number 1, what's caused it? As I said last week, most running related injuries are multifactorial. Most likely, again, it's some kind of training error. As I mentioned earlier, a sudden increase in speed will load the plantar fascia more, or if you've maybe transitioned too quickly from a supportive footwear to a more minimalist style. In terms of running styles, we know that landing on your midfoot or your forefoot will significantly load the plantar fascia more, or if you've got some weakness in the foot and ankle or higher up the chain, that might be contributing. And it could be a whole combination of things, so it needs to be assessed and treated on a case-by-case basis. Can I still run with plantar fasciopathy? So it depends on the phase and how the symptoms behave. If you're in the acute sort of pain dominant phase, I would recommend a little bit of time off running, maybe if it's just 2 weeks, for example, to let it settle down. And in that time, you just do as much as you can to offload it and get that painful tissue under control. That being said, if I do recommend a break from running, which I often don't like to do because I know runners really want to carry on running, then I will recommend doing some kind of cross training, whether that be swimming, cycling, cross training on the machine, just to keep up the cardio fitness and promote some active recovery. In more chronic cases, I do allow my patients to continue running, but they have to stick to a couple of conditions. So I would bring the speed down, so that offloads them a little bit, and I would also suggest that if they are running, that their pain severity level stays sort of 3 out of 10 and below, and it settles within 24 hours of stopping running. If they start to develop morning symptoms again or stiffness the next day, then they've definitely overdone it and they will need to rein the running back a little bit. Number 3, do I need to change my running shoes or should I get some orthotics? So if there's a sudden change in footwear, then it could have played a part, especially if the shoes are more minimalist, as I said earlier. If that's the case, I might recommend switching back to a more sort of cushioned or supportive style. I may suggest adding a small gel heel cup that you can buy them quite easily from Amazon or in Boots, and just adding that into the shoe, which can give a little bit of offload, make the heel a little bit more comfortable, especially in the acute phase, or if you work on your feet a lot, or if your shoes are quite hard. In terms of orthotics, they are super expensive to buy, especially because you really should be getting custom made ones and not just off the shelf ones. So what I would tend to do in my practice would be to make a little foam orthotic as a temporary solution, give that a try if it helps the symptoms, and that would indicate that you benefit from having a custom made one, and then you might want to go and invest the money in seeing one of my podiatry colleagues who can do that for you. And as I said last week, I always say form before footwear. So if there's nothing obviously wrong with the shoes, I'm more likely to play around with someone's training program, their running style, or address any sort of strength and control deficits they might have. Okay, number 4, will massaging, foam rolling or stretches help? Well, there's a small amount of evidence that plantar fascia specific stretches can help. If we go back to the diagram here, this plantar fascia is super thick. I don't know if you've ever looked at a cadaver, probably wouldn't have done it unless you were a physio or a medic, for example, but this is super thick, can be like 5 millimeters thick. The chances of lengthening it with stretches is very slim, but some people do get relief from stretching the plantar fascia and the calf, in which case there's no harm in doing it, but it will only provide some short-term relief. And you also have to be careful with stretching, because when you stretch the plantar fascia, it actually compresses the insertion of the fascia over the bone, which in the acute phases might not be tolerated very easily. So I tend to back off those types of stretches in the early days. And instead I might do some massaging or recommend some foam rolling to the calf area, or even with a ball under the plantar fascia itself, which can provide some short-term relief. And it could be included in my treatment plan alongside a good rehab program. So number 5, will icing or anti-inflammatories help? So again, in the acute sort of pain dominant phase, then yes, a short course of anti-inflammatories combined with activity modification, offloading can definitely help. Icing can help, but the mechanism as to why that helps is a little bit up in the air. Again, if you get short-term relief, then there's no harm in giving it a go. I would recommend, if you want to do that, that you should freeze a bottle of water and then roll it under your foot and the painful heel for about 20 minutes after having a run. So plantar fasciopathy, again, it's a tricky one to manage. It really depends on the patient and their specific symptoms and how they behave. Often I find with rehabilitation, it's a little bit of trial and error to get the treatment right for that specific patient. So I've been asked to share some tips for people with plantar fascia pre and post running. I tend not to recommend static stretching pre-running, as I said last week, as a rule of thumb, but I don't mind my patients doing sort of a dynamic stretching routine to warm up. So last week I showed you in my shin splints talk how to do a dynamic downward dog. That's a great one to do because it just gets your big toe mobilizing if that's stiff. It also gets your calf mobilizing, and it gets your hamstrings mobilizing, and your lower back and everything else that you need for running. So during running, as I mentioned earlier, if you're in the chronic phase, then you can continue, but you need to modify how you're running. So rein in the speed work, and also make sure your symptoms aren't going over a 3 out of 10 and settling within 24 hours. And also, as I said last week, with anything, we want to try and reduce the load going up the chain when you're running. So think about landing softly, try not to land too noisy. So you might want to, if you run with headphones, take them out, have a listen to how you're landing and try and make that sound a bit quieter. The other thing that can help is sort of shortening your stride and increasing your cadence a little bit if your cadence is on the lower side. So the cadence, again, as I said last week, is how many steps per minute you take. And ideally, if you're sort of below the 165 point, then with this condition, it might be worth trying to increase it by about 10%. And then post running, again, happy for you to do some slow static stretching, whether that be calf stretches or plantar fascia specific stretches, as long as they help, you find them relieving. And again, if you're in a little bit of pain, then as I said, you could try some icing using that bottle of water. In general, I always recommend fitting some strength and conditioning work into your routine around twice a week. So I'm just going to show you through some plantar fasciopathy specific exercises that can help and would be good to include in your program. Okay, so if you're in the acute or pain dominant phase, these are some good exercises to do to strengthen up your foot and ankle without the additional load of weight bearing. Okay, now obviously in clinic I would tailor this to the patient sat in front of me and would focus on the muscles that are weak, but there's no harm in doing these as they're unloaded, as I said, and they shouldn't aggravate anything. So exercise number 1 is to get your tib post working, which is the muscle that points your toes down and in. So good exercise, and you need a resistance band for this, and you just put it under one foot to pin your foot down, to pin the band down, sorry, and then you put it around the toes of the foot that you're going to work, and you're just going to point down and scoop up. Okay, and as you do this, you should feel a little bit of a pull up the inside of the ankle there as you work that muscle. And I would do about 15 reps and 3 sets of that. Okay. The other thing that can be weak in people with plantar fasciopathy is the toe flexors. So working those is not a bad idea. So for that you can use a towel just on the floor. And all you're going to do is scrunch up the towel, so just using the muscles that flex the toes, okay? And you can spend a couple of minutes doing that on the affected side. Okay, so I'm going to show you another exercise that can be quite useful in the acute stages as a little bit of a progression of some of the other exercises I showed you. So I really like this exercise because it brings in the rest of the chain, so your core, your glutes, your hamstrings. But it's also what we call an isometric exercise. So you're working your foot in its mid-range without any compression on the plantar fascia insertion at the heel. Okay, so there's no movement through the foot, so you're not going to get that compressive load. And yeah, we call this an isometric exercise, so we're going to hold it for a bit longer. Okay, so what you need is a step for this one. So you can use the bottom step of your stairs, or you could use a low bench, whatever you can find. And you're going to lie down with your toes, just the big toe joints on the edge of the step, okay? And then from there, you're going to bridge up, and then on the affected leg, keep that leg down and straighten the other leg, okay? So you're working your calf muscle quite hard with this, as well as glutes, hamstrings, core below. So I'd hold that for about 20 to 30 seconds and maybe try 3 reps on each side. Okay, so in the more chronic phase, so for people that have had the symptoms for more than 3 months, they don't have that really irritable plantar fasciopathy, and they're struggling with load tolerance. We want to try and increase the load on the plantar fascia. So what I've got here is a step, and I've also got a folded up towel. So the reason for the folded up towel is to try and bring the plantar fascia onto a little bit of a stretch. And it also activates what we call the windlass mechanism, which is really important for propulsion when you're running, okay? So what we're going to do is put the big toe and the toes on the towel, and then we're going to do some heel raising. So just a slight variation on the heel raise exercise. Now you should be working to about a 12 rep max for the first few weeks, and able to do about 3 sets of that. And then over time progressing to an 8 rep max. So you might need to use a backpack and put some weights in that to be able to progress that, okay? So I'm just going to show you now what you need to do. So holding onto something for balance, as I said, weights in your backpack if you've got one, and you're going to just stand with the affected foot on the edge of the towel, and then from there you're going to do that classic heel raising, and you can drop down as far as it's comfortable, and it will get a little bit of lengthening through that calf and through the plantar fascia. Okay, and from there, as people become less symptomatic, I might then include things like plyometrics in their program to help them develop some power, and also what we call the stretch shortening cycle in the plantar fascia itself. So it's good for sort of just general fascial health. So again, that might be something that I might include in the more maintenance phase. Okay. So to recap, if you're in the pain dominant phase, you need to significantly modify your activity to get things under control. That may involve a break from running, and also a bit of offloading, whether that be modifying your footwear, wearing some gel heel cups, taping your foot, and some sort of non-loaded or non-compressive strengthening work, maybe a course of ibuprofen. And in the chronic phase, it's okay to run, but again, with modifications, reining in the speed work and the intensity, and also focusing on strengthening up the muscles under a little bit more load. Okay, so that's it for plantar fasciopathy. I hope I've answered your questions, and feel free again to get in touch with me if you have any further queries or concerns. I should be back again next week for episode 3. Okay, bye.